Okay, I'm gonna try to go through this quickly because there are over 200 terms, and the lab stuff is just identifying it, maybe a few second order, but the study guide will hopefully like fill in any blanks or clinical stuff. So first thing we have are the muscles of the thoracic cage. So your thoracic is gonna be like this area right here. Anything lower is gonna be your abdominal. So if they pin any muscle in this range, all you have to do to distinguish between these three is look at the muscle fibers and the direction they're going in. So imagine you're leaving the house, and as you're walking out, you put your hands in your pocket because you're chill like that. So hands in your pocket would be going towards like your midline. So that's external. So you're exiting the house, external, you have hands in your pocket. Internal would be the opposite direction, and then transversus would just be transverse or like horizontal. So if we're identifying over here, you have external intercostal muscles going in this direction. So they're going down to the midline. Internal, on the other hand, would be going this direction. And then transversus, you can see here, is more like horizontal. So that's all it is. That's the difference between those three. With the vessels, intercostal, anytime you see the word inter or the prefix inter, that means between, and then costal has to do with ribs. So this is going between your ribs. So if this is your rib and this is your rib, it's going between, so it's going to be horizontal. Whereas internal thoracic is going to be more vertical. So this is horizontal, the other one's vertical. So over here, these are intercostal veins, arteries, and nerves. She grouped them together, so she might just pin it, and all you have to say is like intercostal vessels. But if she wants you to distinguish between them, nerves are more like yellowish, goldish shaped or color. Veins are going to be more like hollow and like blue, and then arteries are going to be like more stiff. So if they ask to distinguish between any of them, that's how you distinguish them. But if they just pin there and you just have one option, it's intercostal, that's all you have to choose. Here are your intercostal nerves. This is an example of intercostal nerves. This is on the posterior side. And then internal thoracic will be more vertical. So this is an example of an internal thoracic artery or vein. And then from there, you just distinguish between them. Usually for internal thoracic, if they're going to pin it, there's a donor that literally has this whole rib cage like removed, and then they'll pin a vessel going down vertically like this, and that'll be either the artery or the vein. So that's internal thoracic. So it's going horizontal. Usually they'll pin it like in the back. It's your intercostal. Going down, it's going to be internal thoracic. This is a good example of the internal thoracic artery as well. It's going vertically down. Okay. Did not mean to do that. And then these are also intercostal vein or veins, arteries, and nerves in that order. So blue, red, and yellow. These are intercostal. So the nice thing about this first page is you just got to look at the directions to distinguish between these three and then between these two. Lung surfaces and impressions. So if you have like a piece of clay and you make it into like a round ball, if you poke your finger through that clay, now there's this new like dent inside of it. That's all an impression is. So an impression means like if the lungs didn't have anything around them, they would both be perfectly shaped the way that they are, the way that each one is. But the second you have to fit like a heart in between and this vessel in between and this in between, it starts to have all these like dents and bumps inside of it. So for the left lung, if you think of the way the heart is shaped, the heart really pushes down left because it's anatomical left, where your left ventricle is. So that's where you get the bigger cardiac impression, which is right here. This is all like the left ventricle. This right here is like if you took the lung and you pulled it apart this way. So we're not looking at this side, we're looking more at the middle side. So this is looking at the middle of the lung. So imagine you were inside the heart and you're looking left and right. This is the right lung, this is the left lung. So the key thing here is you have the cardiac impression on the left side. You also have an aortic arch because your aorta will first go up. This is your ascending aorta, so you don't see that on the actual lung. But when it arches, it hits the lung right here. So you get this groove for aortic arch right here. And then the other one that they want is the thoracic aorta. So think of the aorta ascending, then arching, and then it has to go down to the rest of your body. It's still in the thoracic area, so it's called thoracic aorta. Once it passes the diaphragm, it's called abdominal aorta. But the one going down is descending, aka thoracic aorta. Both abdominal and thoracic are descending aorta. Just depends on if they're above the diaphragm or below the diaphragm. So key thing on the left is the cardiac impression, the thoracic aorta, and then the arch in between them. So it's all heart stuff mainly on the left side. On the right side, you also get a cardiac impression here. This is more so like right atrium, because this is right atrium right here. So that's really the one that is pushing on the lung, but it's definitely not as big of an impression as the left ventricle. This is LV, not RV. And then you have, so this is a key one right here. You have an azygous and a superior vena cava impression. The way the azygous vein drains into the superior vena cava is it actually arches first and then it'll drain into it. So that key arch right there is your azygous vein. So if you want to distinguish the lungs, the right one will have the azygous vein arch, the left one will have the aortic arch. And then the aortic arch goes into your thoracic or descending aorta. Your azygous vein goes into your superior vena cava. And then they both have an esophageal impression, but she only has it specified here on the right lung. So this right here and this right here, this orange one, are both a groove for esophagus, but it's, you can see it more on the right lung. So right lung is going to be cardiac impression, esophagus or esophageal impression, and then the two key ones are azygous and superior vena cava. If she's going to ask, it's most likely going to be azygous, superior vena cava. On the left side, it's the main heart ones. So you have your cardiac impression from the left ventricle, you have your aortic arch, and then you have your descending aorta. Now, the difference between the lungs is that the right lung will have 3 lobes and the left lung will have only 2 lobes. So if you compare that to the heart, the easy way to remember it is your right AV valve or your tricuspid is 3 cusps, and then your left is 2 cusps. So you can remember that with your lungs too. So right is 3 lobes, left is 2 lobes. So if you have only 2 lobes, a superior and an inferior, you'll need one fissure that's going to separate them. And because it kind of goes at this angle, it's an oblique fissure. So the right side will also have that as well. So you have superior and inferior. Now you have this oblique fissure. But the difference is now you have a middle lobe. So you need something to separate your superior from your middle. And that's your horizontal fissure, because it's more like horizontal or straight. So horizontal fissure separates superior from middle. Right oblique fissure separates your superior from your middle, but also your superior from your inferior, because your oblique goes all the way around here to where you have inferior and superior. So oblique will separate both, middle to inferior, and superior to inferior. So oblique will separate middle from inferior, and then superior over here from inferior. Sorry if that got a little messy. Okay. Now, in your hilum, so this is your hilum, you have a bunch of vessels in there. The key things to remember are your veins will go inferior and anterior. So this right here is the front of the lung. This is the anterior part of the lung. This is the posterior part. So your veins are going to be the most inferior and the most anterior. So if you're looking at the hilum and they pin either the most inferior or the most anterior, that's your pulmonary vein. You have a main bronchus, which is right here. If you compare it to the left one, the right one goes down vertically. So when you have your main bronchus right here, your right one goes down more vertical than your left one, because your left one like angles more. So that's why this one comes at more of an angle, whereas this one goes straight into it. That's also why, like, when kids choke, it usually gets stuck in their right lobe, not left lobe. So you have a main bronchus there, and then the other one is your pulmonary artery. So those are the three key things. You have your veins, which are most inferior and anterior. You have your bronchus, and then you have your arteries. The main bronchus is the one that first separates. So this right here is actually called a carina, if they ask, but it's not listed on here. This is your main bronchus right here. And then when it starts splitting more and more, those become like lobar, and then later they're like segmental or whatever. And then with the left lung, you only have 2 lobes, but this thing right here is called a lingula. Kind of looks like a tongue impression. So this kind of looks like a tongue. So that's why it's called lingula. And then it's not listed on, actually, it is listed on here. This is a cardiac notch right here, because that's where the left ventricle like really makes an impression on the heart. And I believe that is everything here. Yes, okay. Next stuff. So the last video I put goes into this stuff like more in depth, and it also does like the heart and lung stuff more in depth. But if you think about your thoracic area, we use this sternum right here, which connects at the second rib, to differentiate between what's superior and what's inferior. So everything above this in the green will be superior. Everything below all 3 of these are inferior. But then your inferior gets separated into anterior, middle, and posterior. So all 3 of these are all inferior. Now, your anterior is just whatever is between your heart. So this blue thing right here is your heart and your sternum. So there aren't many things in there. It's like lymphatic stuff and like very small things that you can't really identify or see as clearly as the other ones. So she doesn't even have anything in the anterior mediastinum. She just says superior, middle, and posterior. So superior mediastinum. Think of anything above your sternum. If our middle mediastinum is our heart, everything within the heart is going to be middle mediastinum. So everything above it will be superior. So at the heart level, we have this ascending aorta. We have this pulmonary trunk. Pulmonary veins are going to be on the back of the heart, but still in that middle mediastinum. So it's still technically middle mediastinum. They're located at the left atrium. If you think of the way blood flows, it goes right atrium, right ventricle, to your pulmonary trunk. You have a right pulmonary artery and a left pulmonary artery. Then they come back through the veins into your left ventricle. Left atrium. And the left atrium goes down to left ventricle, and that goes up the aorta into the rest of the body. So the pulmonary veins are located at the left atrium. And then your phrenic nerve, so if they're going to pin the phrenic nerve, usually they're going to have it like hitting the diaphragm. But this right here would be your phrenic nerve. And then you could see it like go all the way down to the diaphragm on either end. So that's all the middle stuff. So anything that has to do with the heart, the only other one that you have to know is the phrenic nerve, because it goes down to the diaphragm. So it goes through that middle aspect. With the superior stuff, so superior mediastinum is going to be everything above the heart. If we're saying the aorta is at the heart level, then when the aorta splits into all of these different things, that has to be above or at the superior mediastinum. So this aortic arch is superior mediastinum. The arch gives off a brachiocephalic trunk, a left common carotid artery, and a left subclavian artery. So the right and left sides split differently. You don't have a brachiocephalic on the right and the left. The right side gives you a brachiocephalic, which then becomes your common carotid artery on the right and subclavian artery on the right. They obviously don't go that high, but like I'm just trying to show or write on this without getting too messy. So the left side immediately becomes your left common carotid artery and left subclavian artery. So that's the difference between the branches of the aorta. You only have 3 branches coming off of the actual arch. The right brachiocephalic becomes right common carotid and right subclavian artery, whereas the left, immediately you get those 2. There's no left brachiocephalic. Now, with the superior vena cava, it's different. With the veins, it's the exact same thing. So this is your superior vena cava that's draining into your right atrium. This one has a right brachiocephalic and a left brachiocephalic. So these are the same thing. And then eventually it would be internal jugular vein and then subclavian vein on each side, but we don't have to know that. So yeah, that's the key thing between the veins and the arteries, is that the superior vena cava has a brachiocephalic on both sides. The artery only has one on the right. And then the trachea we already went through, but this is your trachea, right main bronchus, left main bronchus. The esophagus would just be, I'm going all the way down here. If you think of where they pass through the diaphragm, if you just remember, I ate 10 eggs at noon or at 12, your inferior vena cava goes through T8, your esophagus goes through T10, and then your aorta and your thoracic duct, because it's AT, both go through T12. So with the thoracic duct, we're not going to see this till here, but you can see it if you zoom in, going into the same opening as your descending aorta. So that's kind of like how you can distinguish it from something else. So if they're independent, they're most likely independent, like right here. If you see it going through the same hole or hiatus as the aorta, then that's your thoracic duct. And then we have a vagus nerve and a recurrent laryngeal nerve. So the vagus gives off the recurrent laryngeal. The right and left ones are different though. So you have a right vagus nerve right here. Let me clean this up. Never mind, that was an old picture. Okay, so this is your right vagus nerve right here. It goes all the way down, and then it gives off this recurrent laryngeal nerve. So it gives it off around the right subclavian artery, which is different than the left. Your left vagus nerve comes all the way down, and then it gives off the right subclavian around the arch of the aorta. Or it gives off your left recurrent laryngeal around arch of aorta. So this right here is left recurrent laryngeal. This right here is right recurrent laryngeal artery or nerve. So recurrent laryngeal here, recurrent laryngeal here. So where it gives it off is different. So this is an example of the left one in the donor body. And then this right here, the branch it's giving off around the arch of the aorta, which is going to go back up, is your left recurrent laryngeal nerve. And then we also have an azygous vein. So we already went through this in the last one. when we're doing lung impressions. But your azygos is going to go up, and then it's going to arch a little bit, and then it's going to drain into your SVC, which is not here because they have to cut it to show us the azygos. But that's when you get your azygos. So if they're going to pin it, usually it'll probably be like around where it arches. Thoracic duct we went over, vagus we went over, and the last thing you have is your splanchnic nerves. So this right here is your thoracic sympathetic trunk. You can see it a little bit better over here. This entire thing right here is your thoracic sympathetic trunk. And then each like circle here, those are your ganglion or ganglia. The greater splanchnic are going to be the ones that come off T5 to T9, so these right here. The ones that are lower are going to be your lesser. You also have a least, but she doesn't have it listed. So she's either going to pin greater or lesser. And usually, like, you can see them if she's going to pin them. So if you see something here above what she pinned, then you know it's the lesser. If you see something below, you know it's the greater. But greater is going to be, it's going to have more sort of like branches, and it's bigger. And I believe that's everything on here. Yes, okay. Now, the actual heart itself. So, like we said, you have a right atrium, right ventricle. This is left ventricle. And then, like, higher up, you can't really see it as well from the anterior side, but over there is going to be your left atrium. So, blood flow, always. Anything that comes from your head, neck, and, like, upper arms area is going to be from the superior vena cava. Anything from your lower body is going to go through the inferior vena cava. And then you also have something within the right atrium called an opening of the coronary sinus. And that brings blood back that was going around the heart. So your heart brings in blood and pumps it to the rest of the body, but it also needs its own system. So what happens is off of the aorta, you have a branch called a right carotid artery, and then a coronary artery. When it has to do with heart, it's coronary. Right coronary artery and left coronary artery. And those supply the heart, and then they drain into something called a coronary sinus, which would then come back to the right atrium, and then it would just recycle it over and over again. So the heart also needs its own blood supply. So right atrium, this little ear looking thing is an auricle. So if they pin the little flappy thing coming out, it's your auricle. If they pin the entire thing, it's your right atrium. Right ventricle, I can't even write today. And then we said left atrium, the left ventricle. So your cardiac veins, if we went around this way and turned the heart, this right here is your coronary sinus. The reason you know this is the back of your heart is because you can see these pulmonary veins. So these are the veins that go from the lungs back to the left atrium, bringing in oxygenated blood. So you have 2 on the left and 2 on the right. And the reason you know which side is left and which side is right is because this right here is your vena cava. This is superior and this is inferior. So this entire thing is your superior vena cava, and your superior vena cava drains into your right atrium. So you know this is the right side and this is the left side of the heart now because we turned it. So your coronary sinus has a middle cardiac vein, which is right here. So let me label these. This is coronary sinus. This is middle cardiac vein. And then if you look at your coronary sinus over here, if you continued around this way, and then you turn the heart, that's where you would get the great cardiac vein. So the great cardiac vein is on the anterior side. So this is anterior. The middle, you see it on the posterior. So your right ventricle and left ventricle, in between them, have an interventricular septum. Between ventricles, septum. On the anterior side, that's where your great cardiac vein is found. So this is right ventricle, this is left ventricle. In between, you have your great cardiac vein. On the back, now this is flipped. So this is right ventricle, left ventricle. In between is your middle cardiac vein. They both drain into your coronary sinus, which would then go back into your right atrium, because that's where all blood flow comes back to. So coronary sinus is the big one in the middle. Back, middle, going down is middle cardiac vein, which is right here, and then great cardiac veins on the anterior side going down. So you can also remember which arteries they go with. So your great cardiac vein will go with your LAD, or left anterior descending artery. So put this in blue. So GCV and LAD go together. And then on the back, your middle cardiac vein and your posterior interventricular or descending artery, I'm just going to use the acronym she used here, are the ones that go together. So if you're on the back of the heart and she pins something here, if it's a vein, it's the middle cardiac vein. If it's the artery, it's the posterior descending artery, or posterior interventricular artery, same thing. On the front side, if she pins the artery, it's your LAD, or left anterior descending, or anterior interventricular. If you just want to remember interventricular, there's an anterior interventricular and a posterior interventricular, but she could use PDA and LAD. So if it's the artery, it's the LAD. If it's the vein, it's the great cardiac vein. So these are good. These are good. We did these a little bit, but let me fully go over this stuff. So we said off of your aorta. So this is your aorta. The reason you know this is your aorta is because this thing right here, if you follow it down, is coming from your right ventricle. And if you remember, blood flow goes right atrium, right ventricle, and then to your lung. So that has to be your pulmonary trunk. So that means this right here is your aorta. You can see the right coronary artery that's coming off of it. The left coronary artery, you can't see it because it goes behind the pulmonary trunk. So it's going to go like this behind, and then that's where this LAD comes from. So this picture right here actually cuts off the pulmonary trunk so you can see it. So this is your aorta, right coronary artery, and then now you can see the left coronary artery. Left coronary artery is going to give you your LAD, and the rest is going to be your left circumflex. Your right coronary artery is going to give the right marginal, and then when it goes back around the heart, it's going to give you your posterior interventricular artery, or PDA. So she hasn't broken down here, but right coronary artery will give right marginal and PDA. Left coronary will give LAD and circumflex. Now, this artery right here is important. The posterior descending artery, or posterior interventricular artery, because this determines if you are right or left heart dominant. If this artery, so 80% of the time, this artery will come from the right coronary artery. But there's a 20% time where it actually comes from the left circumflex, which you can actually see here. So this is coming around the left side, because remember, this is left, this is right, and you can always determine that with the vena cava. So from the left coronary artery, so this coronary artery, which goes around, comes here. This is your left circumflex. That's what's giving you this PDA. So this person would be left dominant. if it came from this side, you would be right dominant. So that's an important artery. And then let me label these really quickly. So this right here will be your LAD. This would be your left circumflex. So these both come from left coronary branches. And then over here, this is right marginal. This is right coronary. And then this is PDA, or left posterior interventricular, or just posterior interventricular. Now, these are all the vessels. The actual internal features of the heart now, so they could either just pin right atrium, right ventricle, left atrium, left ventricle, or they could they could open up the actual parts of the heart and ask what's inside of them. So when you open up the right atrium, like look at the cartoon images first before you see the actual ones. This right here is a crista terminalis. Coming off of it, all of these are pectinate muscles. So you can't really see it on this program as much, but this is your crista terminalis. And then they would be coming off a little bit more. Crista terminalis will go like all the way around. And then these little things right here are your pectinate muscles. So if we want to label them, pectinate muscles, and then crista terminalis. Now, you have this thing here that's closed off. It's called a fossa ovalis. This used to be open before we started breathing because your lungs don't work properly until you take your first breath. So that used to be open so that blood can quickly go from your right atrium to your left atrium. Because think about the way blood flows. It usually goes right atrium, right ventricle, then it goes to the lungs, and then it comes back to the left atrium. But if our lungs aren't developed, there's no need for it to go that whole process. So blood would go into the right atrium and immediately go to the left atrium. So it could go down left ventricle and then aorta. So that's a fossa ovalis. It's closed now, but it used to be open before we took our first breath. The other stuff in here, so this is right atrium, this is right ventricle, this right here is your tricuspid valve. So remember when we were talking about the lung lobes, how the right has 3 and the left has 2, and I related it to this. So this is your tricuspid valve, or AKA your right AV valve. And then this tiny hole in there is actually the opening to the coronary sinus. So your right atrium will have 4 sort of like openings. First one is your superior vena cava. All the blood from there coming down. Second one, deep in there, is your inferior vena cava. So it's actually like this circle right here. Inferior vena cava. You have your right AV valve. You have your coronary sinus opening. And then we used to have the fossa ovalis, but that's closed shut now. So it used to be 5. Now there's 4 openings. Those are all in the right atrium. Now, right ventricle, same thing, is going to have the right AV valve we just talked about. It has 3 cusps. So there's 3 cusps. But these things right here that it's actually showing, these are your chordae tendineae. So your AV valve is connected by a bunch of cords or chordae tendineae to papillary muscles. This picture is actually on your left ventricle, but they both have papillary muscles. This program decided to just show the left ventricle ones instead. But you can see here how it's papillary muscles connected to chordae tendineae, connected to your actual cusps in the valve. Left would be bicuspid, but those are what papillary muscles look like. On the right side only, so right only, specifically right ventricle, has something called a moderator or a septomarginal band. This connects your interventricular septum to your papillary muscles, which would then, papillary muscles connect to chordae tendineae, and then that connects to your right AV valve, or the cusps in the valve. So only the right side has something called a moderator band, aka septomarginal band. And then the other stuff they have listed here, so we did this. So trabecula carne, I don't think I have a picture of it on here, but the same way the right atrium has pectinate muscles, so if they pin a bunch of these like muscles going like this inside of your right atrium, it's pectinate muscles. In the right ventricle, if they pin something like that, they're called trabecula carne. So they're the equivalent of the pectinate muscles in right atrium. So let me highlight those. So pectinate is the equivalent of trabecula carne, the other one. We did moderator band. And then coming off of the right ventricle, I already said this, but that's your pulmonary trunk. And then behind it, so you can't see from this angle, you're going to have a right pulmonary artery, RPA, and then left pulmonary artery. And this is where they come into the actual lungs. So that's your right pulmonary artery, and this is your left pulmonary artery. You only have one pulmonary artery. Let me do this in red to emphasize this. So one pulmonary artery on each side. So technically two total, but you have one left, one right, but two pulmonary veins on each side. So I'm going to say 4 total. Here it's 2 total. And then the last thing she has on here is the pulmonary semilunar valve. So this is just this right here. If you look at it from like the top or whatever, it has more of like a semilunar shape. Looks like half a moon. So that's why they name it that. The right AV and left AV. So on the right and left, you have atrioventricular valves. So this is tricuspid and bicuspid. Your other two valves, your aorta and your pulmonary valve, those are called semilunar valves. So if they say semilunar valves, they're talking about these two. If they say AV or atrio, so think of the word atrioventricular, between your atria and your ventricle. So right atrium, all these colors are killing me. So right atrium, right ventricle, atrioventricular. Left atrium, left ventricle, atrioventricular. So just think about the names. Okay, and that's all of the stuff in your right ventricle. Here you can see them. I don't know why this picture is like not clear, but you can see these are your papillary muscles connecting to your chordae tendineae, which are going to your cusps of the valve. This right here is the key one. Septomarginal or moderator connects your IV septum to these papillary muscles. And then your papillary muscles are going to match the amount of cusps you have. So right ventricle has 3 papillary muscles. Left ventricle has 2. The difference, though, is the left ventricle ones, these ones are much thicker compared to the right ones, because your left ventricle is pumping blood to the rest of your body through the aorta. So it has to have a thicker wall to be able to handle all of that blood. Okay, now left atrium, the only 2 things she has are your pulmonary veins opening and your left AV valve. So those we already kind of went over, but these are your pulmonary veins. These are the left ones, left veins, left pulmonary veins. These are your right pulmonary veins, 2 on each side. That's the blood that's coming back from the lungs. So this is oxygenated blood. And then this right here is your left AV valve. So this is also called your mitral valve. And then these are pulmonary veins. Now, left ventricle is going to be very similar to everything we already saw. So you have papillary muscles, you have chordae tendineae, you have the cusps or leaflets of your mitral valve. Only difference, like we said, is no moderator band here. And then this goes to your aorta instead of going to your pulmonary trunk like the other one did. So this right here is your aortic valve opening. She also has here right, left, and posterior. So I also added this picture here. These are the cusps of the aorta. This would be pulmonary trunk, and this would be like right and left AV valves. This is just like a weird view, but I mean, if she asks, there's a right and a left and a posterior. So if she pins something within here, you're gonna have right, left, posterior. I don't know if she's gonna go that detailed. Something cool you can also see here is, so right off of the aorta, when you first get to the aorta, this is your right coronary artery. Change the color. And this is left coronary artery. And then eventually when it arches and then it goes down, becomes your descending aorta, off of the arch, you have your brachiocephalic trunk, left common carotid artery, left subclavian artery. This becomes right common carotid. Sorry. So that's all of the heart stuff. I don't think we missed anything. Okay. Now, this is the recent stuff we did. So I don't know why she has these on here, but if she asks, this is a clavicle. This whole thing is your sternum. This is she just has sternum, so we don't have to go into much detail, but this is the manubrium. This is the body. The key thing here is this is your sternal angle connected to the second rib. And remember, everything above this is going to be superior mediastinum. Everything below is inferior mediastinum. She also has ribs. I hope by now we know what ribs are. And thoracic vertebra. So I don't think she'll ask about any of those. Now, we have anterolateral abdominal wall. So the nice thing about the abdominal wall is it's very similar to the thoracic stuff we went over with the way the fibers are. So remember we said when you're walking outside your house, you're chill, so you have your hands in your pockets. You can see here the muscle fibers are going towards down as if you have your hands in your pockets. So that is going to be external oblique. The opposite direction, which isn't on here, would be internal oblique. And then it's going to be horizontal, it's going to be transversus abdominis, and we'll see that too. But there's something important about the external oblique. As it goes down, eventually it like wraps up like this. It's like you feel like you're hanging onto a cliff. The way your fingers would like wrap on, it's like how the external oblique does it. And that's what forms your inguinal ligament. So this whole thing right here is your inguinal ligament. The most outwards one is going to be your superficial inguinal ring. The deeper one's going to be deeper, but they only have superficial on here. So if she pins her ring, it's probably going to be superficial. So external oblique, the fibers are going in, makes your inguinal ligament, and then you have a superficial inguinal ring in the front. The superficial inguinal ring, again, this is like more clinical stuff, but if she asks, it's larger in males, or wider or bigger or whatever you want to say, because males have to have the spermatic cord go through there, whereas in females there's just like the round ligament of the uterus, which is much smaller. Internal oblique would be, so these also go from most superficial to deep. So this is most superficial, and this is going to be deepest. This is kind of like in between. Sorry for the handwriting. So these right here, look at them. Look at these fibers right here. They're going out. So that has to be internal oblique. These ones are coming in. And you can also kind of see how they're superficial because you can see the actual rectus sheath here. Whereas here it's removed, so this is deeper. This is your rectus abdominis right here, the 6-pack abs or 8-pack or whatever. This is external oblique. I'm going to try to label these and send like a PDF that has them labeled as well. And then external oblique forms your inguinal ligament. So here is your inguinal ligament. And then this right here is your superficial inguinal ring. So that's inferior oblique. Over here, look at these. They go horizontal. So it's the same thing like we did with the thoracic stuff. So this has to be your transversus, not thoracus here, but abdominis. And then this right here is your rectus abdominis muscles, because you can actually see like the red stuff. If she pins like the whiter stuff on the outside, that would be your rectus sheath. It just covers them. Right in the middle, you have this line, literally called line or linea elbow. So just remember that line A, linea elbow, A, elbow. And then you also have a semilunar line. So this right here, let me put it in a different color. So it's like half moon shaped. You have them on both sides. I'm gonna keep the other side so you can kind of see it. But this is your semilunar line. The middle one is linea alba. There's only one of it. Semilunar line, there's two of them. Okay, now, if you were to look at the anterior part of the abdomen, but from behind. So if you pulled this stuff away and you looked at it from behind, this is what we would be looking at. So we're literally behind. In the beginning, we were looking there for the muscles, all that stuff. Now we're going behind. We're looking from the inside. You have 3 folds. You have a, I don't know why she has medium. It's usually median. It's usually median, but I mean, I don't think she'll have both on there. So whatever she calls it, this right here is your median umbilical fold. So she can relate that to the urachus. The one that's a little bit wider is going to be this one right here. That's your medial umbilical fold. And then if you have a medial, you must have a lateral. So you can kind of see them on the first picture. So you have this one, then this one, then this one. But these 3 pictures all highlight them separately. So she could ask what the fold is called, or she could ask what goes there. So here you get the umbilical artery for the medial. And then for the lateral, you get the inferior epigastric artery and vein. But these ones, they'd have to like pull it apart, and you can see it on the opposite side for the donor. So if you see something pulled apart and there's 3 lines, the middle one is just median or medium. Then, so you only have 1 median, but you have a medial on each side and a lateral on each side. All of them are in here. Now, the difference between visceral and parietal peritoneum, or any kind, is visceral would always be on the organ. So if they're going to ask for visceral, it's going to be strictly on the organ. So this all is visceral because it's literally covering each organ separately. Parietal would be more on the outside. So if she asks for a peritoneum and it's not specifically on an organ, it's parietal. If she pins an organ and says what peritoneum covers this, it's visceral. Now, these are some examples of them. So the falciform ligament is this one right here. This splits your liver, so this is a liver right here, into right lobe and left lobe. Your greater omentum will come off of your greater curvature of the stomach. So this is greater curve stomach. Your lesser omentum, so this is greater omentum, and this is going to be lesser omentum, would be coming off of the lesser curve in your stomach. And we'll go over this in a little because there's a part on the stomach. But that's how you distinguish them. Mesentery usually is going to be, so this is mesentery. This connects, so in this case, the small intestine connects small intestines to the posterior abdominal wall. So that's the key thing here, is it has to be connecting it to the posterior abdominal wall for it to be mesentery. So that's the difference between mesentery and omentum. The omentum just comes from the greater or lesser curvature of the stomach. The mesentery connects to the posterior abdominal wall. Now, your posterior abdominal wall, we have a bunch of muscles here. The big, thick muscle that comes down like this is your psoas major. I can't stick to it. So this is psoas major. The little tendon that goes with that muscle is smaller, so it's psoas minor. We then have, so this right here, if you removed all of this stuff and you could just see the pelvis by itself, that would be your iliac fossa. So the muscle there would be your iliacus muscle. The other one, if you think of a quadrilateral, has 4 sides. So quads is 4. So 1, 2, 3, 4. This is your quadratus lumborum. Your psoas and your iliacus, so if you look at iliacus and psoas, together combine to form an iliopsoas, which she doesn't have on here, so ignore that. But yeah, they combine to form an iliopsoas, which is like one of the most important like flexors of the hip. And the last thing we have is the diaphragm. She didn't specify. I'm assuming this is the pelvic diaphragm. So it would just be the stuff all the way on the bottom. Those are your, I mean, again, those aren't specified, but it's your levator ani and your coccygeus muscles. But if she'll probably just pin the bottom and be like, what is this? And it's just pelvic diaphragm. Now, the most important muscle here, especially when it comes to nerves, is this, your psoas major. If you look at your psoas major right here, there's a nerve that goes anterior, or like literally right on it. There's a nerve that's more medial to it. And then you have a bunch of nerves that are lateral. So this is lateral, 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 and lateral. So this is your psoas, for example. You have a bunch of them that are lateral. There's one key one that literally goes on it and one that goes medial to it. So this first one right here, if they're going to pin any of these nerves, they're going to show you all of these. They're going to show you this going this way, this going this way, this going this way, this. You would see your psoas and the nerve on it, and then the one medial to it. So the highest one is the lowest of your thoracic. So after your thoracic, you're going to get your lumbar stuff. So your thoracic is going to be above your abdomen. So if something is on the bottom of your thoracic, it's going to be T12, because that's the lowest number of thoracic. So that's how you remember that it's called subcostal nerve. Sub, like a submarine, under, so like the bottom. Costal has to do with like ribs or like your thoracic range or area. So subcostal nerve. That's the one you use to let you know that everything after this is going to be lumbar. So first one after is your iliohypogastric. So you can see the subcostal one right here. The one below it is iliohypogastric. The one below that, so on this side you can see, and then you can kind of see it on this side as well, is your ilioinguinal. The way I remember it is if you just say hi, H and then I, it's H first, then I. I don't know if that helps. So iliohypogastric and then ilioinguinal, if she asks for the actual like nerve root, so we said this one is T12. If you remember I, L, I, these are both saying I am L1. So they're both L1. And then it goes hypogastric and then inguinal, if you remember high. Then you have two, this big one going down. This is like one of the most important nerves that we need to know, because later on, that's going to hit your thigh. And if you think of your thigh bone, that's your femur. So this has to be your femoral nerve. The one going lateral to it, this one just does skin stuff. If you remember like the arms, if you remember when we were doing like the forearm or whatever, you had a musculocutaneous that goes lateral forearm. So this one does lateral skin to the femoral area, or lateral femoral cutaneous. She says LFC a lot. Liverpool. Sorry, that was a bad joke. Okay, so the thick one going down is femoral. The one going lateral to it is lateral femoral cutaneous. And then we remember subcostal and then high. So hypogastric and then inguinal. Now, the one going on your psoas major, the one literally going on it, this is how you're going to remember it. If you think of your psoas muscle and how it's angled, it literally separates your genitals from your femoral, or like leg side. So the nerve there is called genitofemoral nerve. It actually has like a genital branch and then another branch that splits, but just remember genitofemoral, and that's the one that's on your psoas. So if they pin a nerve and it's on your psoas, if you don't put genitofemoral, I don't know what to say. That's the easiest thing in the world. Okay? Genitofemoral on your psoas. The one going medial to it, so the most medial one, it actually has its own opening down there called an obturator foramen. So if the opening is called obturator foramen, then this must be your obturator nerve. So subcostal, iliohypogastric, ilioinguinal. You have a femoral and then a lateral femoral cutaneous. Those are all lateral. So these five right here are all lateral to psoas major. This is literally on or anterior major, and then this one is medial to psoas major. Okay, is there anything else on here that we did not do? Nope, I think that's everything. So here you can see this big thing right here is your psoas major. So if you follow these, it's this whole thing and this whole thing going down. Then your psoas minor is this lip. Like it's a small muscle, but then you can really only see the tendon when you get down here. Okay. Now, this is the abdomen stuff. So our stomach. When we were talking about the omentums, we said greater omentum comes from greater curvature. Lesser omentum comes from lesser curvature. So if this is your stomach right here, greater curvature, lesser curvature. The parts of the stomach, this is your fundus. Like imagine you're like at the top of a slide, you're like, oh, this is so fun. I don't know if that helps. Fun, fundus. This entire thing would be your body. And this is your pylorus. She only has pylorus on there, so I don't know if she wants to actually go into the specific parts or details of the pylorus because they went over it in lab. But if they do, the big curved part is called your antrum. The opening is your canal. Sorry, not the opening, but like the actual thing it travels to is your canal. And then the opening is the orifice. And then these things right here, or the pictures right here, the sphincter, these control like how much goes through. That's just sphincter. So the whole thing is just a pylorus. If you get specific, those are the ones. Now, you have your large intestine. So the way food comes down after going through your esophagus, goes into your stomach, goes through all of this, then goes to your duodenum. Then you have, this is all also small intestine, including your duodenum. This, the way it splits, like usually this right here is like jejunum, and this is ileum. So if you go from top to bottom, if you just remember, like DJI, or like DJ Ili, it goes duodenum, jejunum, then ileum. After that, you have, so let me label these quickly. So we said duodenum. This is both jejunum. So I'm going to put J plus I because it's both highlighted together. Then over here, you have something, she doesn't have it labeled, but this thing is called an iliocecal junction. It connects your ileum to this part, which is your cecum. So this thing right here. So that just connects your small intestine to your large intestine. So this right here is the beginning of large intestine. So I'm going to put Li. This tiny thing coming off on the bottom, that's actually your appendix. That's the thing that's like so useless we can live without it. Then you have ascending colon, transverse colon, descending colon, and then the S-shaped one is going to be your sigmoid colon. Now, we did all of this. So we have 3 parts in your large intestine. So these are only your large intestine, called haustra, tinea coli, and omental appendices. She also used the word epiploic, so she could also say epiploic appendages instead of just omental appendages. So this picture is good because it kind of like shows all that stuff. Your haustra are these actual things. So each one of these would be a haustra, haustra, haustra. So if she pins that, it's your haustra. Your tinea coli is this, it's like smooth layer going all the way around. That's your tinea coli. And then your omental appendices or appendages are these little things that are sticking out. So there, and so on. So that's what those 3 things are. Over here, these would be your haustra, because these things that are going around, it's like the little curves or whatever on top of each one of these things in your colon. These are your omental or epiploic. They're usually appendages. I don't know why she has appendices, but I'll write it the way she wants. And then this would be an example of your tinea coli. So if you see the smooth layer, it's tinea coli. If you see the tiny things, it's your omental appendices or appendages. And if she just pins the outside of them, it's your haustra. So large intestine's all good. Now liver. So we already saw this thing right here called a falciform ligament. This splits the liver into a right lobe and a left lobe. So this would be right lobe. This would be left lobe of the liver. Your falciform ligament, at the end of it, so right here, becomes called ligamentum teres. Make sure it's still recording. Okay. So if they pin this tiny thing here, it's ligamentum teres. The whole thing is falciform ligament, though. What else is on here? On the back, you can see this lobe is your caudate lobe. And then remember, anything that has to do with four sides, so 1, 2, 3, 4, is going to be your quadrate lobe. So this right here is your quadrate lobe. Now, you have this entire area called a porta hepatis. It has your portal vein, proper hepatic artery, and common bile duct. So, portal vein, hepatic artery, and bile duct. Your portal vein, the location of it when you're looking at the abdomen, is actually behind the neck of the pancreas. So if we're looking at the pancreas, this right here would be the head of the pancreas. So head of pancreas. And the whole middle part is your body. And at the end is your tail. Your tail is towards your spleen. So this is actually your spleen. And then with your gallbladder, you have the top part, which is the fundus, just like the stomach. Remember we said top part is fun, top of the slide. Everything in the middle is your body. And then the end right here is your neck. And that's actually what your cystic duct is connected to. So your cystic duct connects from gallbladder, connects to your hepatic duct from your liver. It's called a common hepatic duct because there's a right and a left. We just have to know it's a hepatic duct or common hepatic duct. So cystic plus common hepatic equals common bile duct. And you can see all of that in here. So this right here is your common bile duct. This is your cystic gallbladder, common hepatic duct, which makes this your right hepatic duct, and that's your left hepatic duct. So bile, common hepatic, cystic. This right here is your hepatic portal vein, which is also in the porta hepatis. If you look at what drains into your hepatic portal vein, this right here, which we'll see later, is your superior mesenteric vein. This is your splenic vein because it's coming from your spleen. The difference with the superior mesenteric vein and your inferior mesenteric vein is superior drains into the porta hepatis directly. Your inferior actually goes into the splenic first, and the splenic is what drains into there. So your inferior does not directly drain into your portal vein. And the reason for that, if you think about it, is your aorta goes like down the middle of your body, but your vena cava is on the right side, right? Because that's where the right atrium, right ventricle is. So it's like more here. So the stuff from the right can quickly drain into it, but the stuff from the left might have to go into something else that is going to cross to the other side. So you also see that in the gonadal veins. So your right gonadal vein, write this down. So right gonadal vein. Gonadal just means either testicular or ovarian. So it depends on like which gender it's coming from. The right one goes into your IVC. The left gonadal vein goes to the renal vein, well, left renal vein, which would then go into IVC. So that's something, probably more the clinical stuff, but she could ask about. Okay, I think that we went through everything on here. Did I miss anything? Oh, this thing, the ligamentum venosum, that's just, let me see if I can get a good picture of it. That's this thing right here. So now when you're older, it like fuses, but before it was like some opening or something. But it's literally like if you find your caudate lobe, that thing right next to it is your ligamentum venosum. It's a ligament now. Okay, 8%, we're still good. Okay, now kidney stuff. So kidneys. You have cortex, medulla, pyramids, which go into your papilla, columns, minor calyx, major calyx, pelvis, sinus ureters. The nice thing about the way they're listed here is that's kind of like the order they go in. So your cortex is everything here on the outside. So this is your cortex. After your cortex, you have your medulla. These are pyramids. Your pyramids are inside of your medulla. You can tell there's like some extra stuff here that's not here. So your medulla is under your cortex. Pyramids are within the medulla, but like most of the medulla is just your pyramids. There might just be like some extra things or whatever. Where your pyramids end is the papilla. So end of your pyramids, this is your papilla. End of each pyramid is your papilla. That has not hit your minor calyx yet. So minor calyx would be this stuff right after. That's all minor calyx. These are just your renal columns. So imagine if you were looking at each one of these pyramids, just the stuff in between them, these are your columns. So they're shaped like columns, whatever. Minor calyx. Your minor calyces will join to, or all together dump into major calyces or calyx. And then your major will go into the renal pelvis, which then goes to your ureter. This entire thing here that's between the medulla and renal pelvis is just called your renal sinus. So that's the entire area. So above your renal sinus would be the medulla. Above that would be the cortex. But if you just remember that order, you can kind of see here as well. So you have your cortex. Everything here is medulla, including the pyramids. At the end of the pyramids, you have your papilla. Each one's going to drain into a minor calyx first. So minor, minor, minor together gives you a major. And then you go to your renal pelvis. And then you go to your ureter. And then anytime, I mean, if there's something on top of the kidney and they pin it, it's going to be your supra. So above renal, above your kidney gland. This is also called adrenal gland. So anything they pin, this was the only picture I could find on the thing, but anything above your kidney is going to be your suprarenal gland. All right, last thing. Okay, we have the abdominal aorta. So now we're past the diaphragm. Remember, this is at T12, right? Okay, good. So we're past the diaphragm. This is your abdominal aorta. I have 7%. You have 3 things that you immediately see. 1, 2, 3. These are your first one is celiac trunk. Then superior mesenteric artery, and the one under it has to be your inferior mesenteric artery. Now, the only one she has listed here with the actual branches of it is your celiac trunk. So these 3 come off your celiac trunk. This is your celiac trunk. It's literally just this like bulge, but it has 3 branches, which were obviously cut off here. These are the 3 branches of your celiac trunk. So first one going to your spleen is splenic artery. Next one going up to your stomach is left gastric artery. And then the one going to your liver is your common hepatic artery. Hepatic means liver, gastric means stomach, splenic means spleen. So if they pin one of these arteries, you're going to be able to see the other 3 arteries as well. So just look at which one's going to your spleen, which one's going to your stomach, which one's going to your liver. She doesn't have right gastric labeled here, and that's because it comes from a different artery, specifically from like the hepatic artery, but we don't have to know that. But I just put that down here for like extra stuff. So we did that. Okay, off of your aorta, you also have your renal arteries. So right renal and left renal arteries. So renal arteries. This is right, that is left. The other thing you have is your gonadal arteries. Remember, in males, it's called the testicular artery. In females, ovarian. She could just use the word gonadal, which means the same. So this would be your right, and this would be your left. So looking at your abdominal aorta, celiac trunk, superior mesenteric artery, inferior mesenteric artery, right renal, right gonadal, left gonadal. That's it. Now, you also have the veins. So remember when we said this is your hepatic portal vein? We said this thing is your superior mesenteric vein. The other one was your splenic vein. The one draining into your splenic vein is your inferior mesenteric vein. Does she not have it labeled? She does not have inferior mesenteric vein labeled. Whatever. Okay. Now, this is your inferior vena cava. Your inferior vena cava and your abdominal aorta split with similar names. So, inferior vena cava becomes right and left common iliac vein. Left common, or sorry, it's right and left iliac veins. Let me fix that. No, I was right. Okay. We're going to go back. So, right common iliac, left common iliac. Your common iliac, remember, anything common is going to split, then becomes external iliac and internal iliac. So same thing here. This will be common, internal, external. So that's the same way your aorta, I understand. The same way your aorta also splits. So your aorta, abdominal aorta, will go right, left, common, iliac artery on the right, same thing with left. And then same thing, you get the external and then internal. So this would be your common iliac vein, and then splitting into right or external and internal. So common iliac becomes external plus internal. Internal, external. Okay, so this is more clear over here. So that's right and left common iliac, and then I'm going to save the external and internal for here. So this is external iliac vein, and this is internal iliac vein. And then here, these are your gonadal veins. Remember, right drains into your IVC. Your left will drain into your renal vein, which would then drain into your IVC. So this is left renal vein. This is right renal vein. Oh my God, the handwriting is awful. This is IVC. And that, I believe, is everything. I also added these if you want to see like the way they all break apart in their branches. So you'll see like the celiac trunk over here will have your, where is it? So celiac trunk will have your splenic, left gastric, and your your common hepatic. And then here you can see your, for superior mesenteric artery, this is the one she used MRI for the acronym. So middle colic, right colic, and ileocolic. And then here you can see your inferior mesentery branches, which is like your left colic, sigmoid. And this is like all like the vein stuff. So you can see inferior vena cava, right renal vein, left renal vein, right common iliac, left common iliac, which then becomes left internal, left external, right internal, right external. They don't have the gonadal on here. Oh no, they do. So your right gonadal goes straight into it. Your left gonadal would drain into your renal vein, which would then go into your IVC. So this is just like added stuff on here. I would just focus on the actual terms because that's probably what she's going to ask. And then hopefully the study guide will fill in any blanks or go through any clinical scenarios. Okay, I hope this was helpful. Sorry for any mistakes, bad handwriting, whatever. I was trying to get it done as soon as possible, but obviously I couldn't. Thank you guys, and good luck.